Okay, when you get to the chapter on hemostatic agents, those are going to be agents that help us stop the flow of blood, which is important in surgery because we don't want our patients to bleed out. So hemo meaning blood, just like a hematologist is a doctor who studies blood, or a hemostat is a clamp that we use to clamp on a blood vessel, and static is going to be sort of generally stand for stopping or staying still. So we're going to stop the flow of blood. Okay, so hemostatic agents. There are different types of hemostatic agents. We have active hemostatic agents, and those convert fibrinogen into fibrin. And if you remember in our clotting cascade here, platelets bind to the collagen in the connective tissue surrounding the blood vessel. Then they become activated platelets. They change their shape and they call in more platelets and activate clotting factors. And there's this whole huge cascade of clotting factors which involves vitamin K and calcium in order to work. And the clotting factors convert prothrombin to thrombin, which is the active form, and thrombin converts fibrinogen to fibrin. And fibrin is the mesh that we get at the site up here. So the platelets all form up here because they're called up here by the ones that touch the collagen, and then you get the fibrin mesh. So the active hemostatic agents are going to be involved in this last pathway down here. They are going to convert the fibrinogen into active fibrin. So they are at the end of the clotting cascade, and one of the clotting agents that we're going to use for that purpose is actually thrombin. And so it can be applied to the wound to form a clot, because the thrombin in our body is what actually converts fibrinogen into the active fibrin. So this is one of the reasons that thrombin can never be injected into your blood system directly, because you don't want a blood clot floating around in there. So thrombin is the natural chemical in the body that converts fibrinogen to fibrin. So that is going to be an example of an active hemostatic agent. We also have mechanical, and that is going to mean something that we put on the wound to give the blood clot a place to happen. And so it's going to give the platelets a place to stick to, a place to park. And so back on our blood vessel up here, it is going to sort of act like a little barrier here. Like we're gonna lay it across the wound, and then when the platelets get up here, they're going to have some place to hang on to. So they're kind of a physical mesh thing that we're going to put up there, and then eventually when the platelets have done their cascade and things, then the fibrin will come up here and form a clot again. But it just gives the platelets a place to stick onto on, like, say, a larger surface area. Another form of hemostatic agent that we can have is going to be collagen. And if you remember, collagen is part of our cascade up here way at the beginning. Collagen plus platelets is what activates the platelets. And so it's the platelets touching the connective tissue on the outer edge of the blood vessel that causes the platelets to become activated. So if you just put collagen right there on the wound, then that can activate the platelets, and that can start the whole cascade for clotting. So collagen in the form of gelatin or absorbable collagen can be placed, or flowable is also made of gelatin, which is going to contain collagen. Those will activate the platelets. So this collagen is also going to include anything with gelatin. We can also have a fibrin sealant, which is going to, of course, be this last step in our clotting pathway, where the fibrinogen turns to fibrin, and that actually is the clot that forms up here, this ring. And so it's basically going to be pretty similar to the mechanical that we talked about, where this is going to be something that we're going to apply to the wound up here, but it's going to already have the fibrin in it. So this is already the active form, so this fibrin is going to help this clot form faster because it is already providing some of the fibrin needed for your body to clot right there. And then one final form of hemostatic agent that we have is cellulose. And that is going to be for platelet adhesion, which is the term for the platelets all joining and sticking together up here in the clot. So when the platelets all bind up here and start to stick together, that's going to be adhesion. So the cellulose is going to just be something that we apply here to the edge of the wound that is going to give these platelets a place to stick to. So that's going to be at the top part of our cascade of blood clotting. So those will become activated and then follow out the clotting cascade from there.